Cardiovascular conditions are accounting for 1 in 10 deaths, with cases rising sharply between 2007 and 2017.
Cardiovascular disease are the highest contributor towards non-communicable diseases in Uganda and globally. So it is very important that we tackle the issue at its heart and focus our attention to the biggest issue presenting in our diet, one of the biggest threats presenting in our diet.
Experts say trans fats in processed foods are driving the rising trend.
278,000 deaths, according to World Health Organization, annually have been recorded associated with consumption of trans fatty acids, with high intake raising the risk of death generally by 34%, and specifically deaths from cardiovascular diseases by 28%. In Uganda, cardiovascular diseases accounts for 10% of all deaths. That we think that is extremely high, making it the most common non-communicable cause of death in the country.
Science shows trans fats worsen cholesterol, raise heart risks, and cause early death.
We want to encourage the processors to make sure that they use the right technologies so that they don't produce these industrial trans fatty acids. And we work closely with the Ministry of Trade, with the UNBS, and they will take up their responsibilities in making sure that that is done.
Recently, media reports on a United Nations draft ban on trans fats are causing confusion.
Such statements are not right, and that the focus, like already said, is on regulating industrially produced trans fatty acids. We are, as a country, working on a regulation to regulate these trans fatty acids, and we are calling and urging government to speed up the process because, like we have seen the statistics, especially at Uganda, from our Uganda Heart Institute, they are alarming.
Stakeholders or actors out there need to understand that our message is about those industrially produced trans fatty acids that have been proven to increase the risk of cardiovascular diseases such as stroke, heart attacks.
We do not believe that there can be a ban on naturally occurring trans fatty acids, including, for instance, the beef that we eat, the groundnuts, the milk, or our locally produced edibles.
Government and stakeholders are drafting rules to cut trans fats and save lives. So that Kaye and Robert Whiter, UBC News.